Welcome to today's edition of The Beat Podcast. I'm thrilled to be joined by both of you, pharmacy residents, and I think we should just get right into it. I'm here with Victoria and Jennifer, and I'd love to have you introduce yourselves and tell us a little bit about yourselves, and then we'll get into what you love about being a pharmacy resident here at Santa Clara Valley Medical Center.
Sounds great. So my name is Victoria. I am a PGY1 acute care pharmacy resident. So I just started here at Valley in July. I actually moved here from Seattle because I did my pharmacy school at the University of Washington School of Pharmacy. I actually went there for undergrad as well. So it was a pretty big change for me moving to the Bay, but it's been a pretty great experience being here so far.
My name is Jennifer. I am currently the PGY2 Health System Pharmacy Administration and Leadership, or HISPAL, or we just like to say it really easy, the administration resident. I actually did my PGY1 here at Valley, or County of Santa Clara Health System, as we call it. I was on the acute care track. I was born and raised in San Jose, so there was an aspect of really wanting to, come back right back to home.
That's wonderful. Well, I'm glad that you both are here from far away and from near. And in talking about why you wanted to come here, can we speak to that first? And then we'll talk about the actual experience of being here. So all the way from Washington. It's rainy outside. It looks like Washington right now. But tell us what made you consider the Bay Area for pharmacy residency.
Yeah, I think for me, like when I was looking for pharmacy residency, I think, I made a checklist for myself of things that I really was looking for in a residency program. But to be honest, on the top of my list was location. I have always wanted to move to California. So a lot of my programs that I applied for were in the California area. I always knew that the Bay Area was similar to Seattle, so I feel like it wouldn't be too much of a change. So I think those are the biggest things that drew me here. But, I think also I really wanted to work at a large community hospital. I wanted to work with a diverse patient population. And I also wanted to work somewhere with some informatics exposure, which is one of my practice interests. So it worked out pretty great that I ended up here at this program.
For me, I think, as Victoria mentioned, location was the biggest experience. But I would say that I like to say I was born and raised here. Actually, prior to pharmacy school, I volunteered at Better Health Pharmacy, which is one of our pharmacies that offer free medications to qualifying patients, patients who live in our county. So I think really having my start at Better Health Pharmacy really made me want to work with the patient population. Our patients here, we have a lot of unhoused patients that need a lot of help. So that was really what drew me here. And, when I was doing my APPEs or, in our last year pharmacy school, we get these experiential rotations in all these different hospitals. I came right back to San Jose and I did some of my rotations here at Santa Clara Valley Medical Center. And I loved my preceptors and all the support I got. So I think that's what really drew me right back here for residency.
That's awesome to hear. And we were talking a little bit about the show began, how I don't have a clinical background, if you will. I'm a multimedia expert, but I, growing up, considered pharmacists just the people behind a counter at the drugstore, giving you your flu medication. I had no idea. So was it long ago that you either considered being a pharmacist or even knew all that it really entailed? Because there is so much to it. Hearing about the different specialties and things that you do within the pharmacy program itself, when did you know? And then going into the specific programs, deciding what you wanted to focus on.
Oh, yeah. I think definitely in the beginning, when I was applying for pharmacy school, I think that's like the impression a lot of people have. Pharmacists, we are just dispensing the medications. But I think for me, once you get into pharmacy school, you realize what a world pharmacy is. There's so much pharmacists can do. We have our ambulatory care, pharmacists who manage disease states like diabetes. They adjust medications per protocol. We have our emergency room pharmacists who are right in there, helping patients, grabbing the medications for coding patients. And then I think pharmacy school is when you realize, oh my God, there is so much out there. I think Victoria can speak a little bit about informatics because that's, I feel like, a field people don't really realize pharmacists can be part of.
Yeah, definitely. I feel like for me, I ended up in pharmacy a little bit more like serendipitously. I actually really only thought that pharmacists could work behind the counter when I applied to pharmacy school. Then I got lucky. I volunteered in a hospital setting and I went to pharmacy school and like saw all these clubs and like saw all these great pharmacists come through who worked in like a variety of specialty settings. Like Jennifer was saying, like, yeah, in the ER or like even in like neurology units. I kind of say it to everyone, like, these places that medical residents can specialize in, pharmacy residents can also. I don't think a lot of people don't realize that, right? And then also in the hospital, every time someone puts in an order, a pharmacist has to verify it. So we really do play like a very important role in terms of like medication administration in the hospital and making sure that everything is safe and efficacious in terms of medications there, right? So I think for me, how I ended up into my practice interest of informatics and internal medicine is I also think I got a little bit lucky when I was doing my inpatient internship as a student in school. I was actually interviewed for my job by 2 informatics pharmacists. And I remember they were like, yeah, we work in informatics. I was like, I don't even know what that is. I was like, I didn't even know pharmacists could first off work in the hospital. And then now I'm finding out that they can also do like IT stuff. And I had computer science interest before. So I think it's pretty cool that pharmacy is a really big profession. It's not just working behind the counter. We can work in all these different fields, and there's like nuclear pharmacy too. It's just really cool what pharmacists can do.
So practice interests, there's so many of them. You mentioned one as well. HISPEL, is that what you said?
Yeah.
Can you tell us what that is?
Yeah, so HISPEL, you can just think of it as pharmacy administration. So I guess give it a little context. So most residents after pharmacy school, there are lots of different paths that pharmacists can choose. They can go directly into work, and there's a thing called residency, there's fellowships, there's a lot of things, but specifically residency, people can do up to 2 years. So we like to say PGY1, first year residency, or PGY2. First year, mostly is just think of more generalized residency. I mean, there are some places, that are specialized, like, if you're doing like a PGY1 at Lucille Packard, for example, it's more pediatric focused. But if you do a PGY2, you want to specialize in something. So for me, during my PGY1, I realized that my love was in, if you think like health administration, I love making impact in a more bigger picture way, seeing things from a bigger picture. I love working with people. I love having my team advocating for them. So it didn't take me until residency to realize that's where my interest lied in. It's a big world out there in administration. Victoria can contest. It's like another beast.
It really is.
So backing up a little bit, you decide you want to do pharmacy residency. You match here, you come here to Santa Clara Valley Medical Center. What's your first impression of the hospital?
My impression is, wow, it's big in terms of like, it's very complex. There's a lot of working parts. I think now, especially since we like to refer to ourselves as enterprise. So even in pharmacy, we have not only Santa Clara Valley Medical Center, we have O'Connor Hospital, we have pharmacy there. Now we have St. Louis Regional Hospital. So I think what is a unique experience here is how big our system is, how complex, all the moving cogs in our system to make us work as an enterprise entity. I think that's what I realized was like, whoa.
That's a great point. Here. Yeah. Santa Clara Valley Healthcare, we're proud to be many clinics. And like you said, those 3 hospitals as well. What about you, Victoria? What was your first impression coming here and stepping onto campus out of state for the first time?
I think similar to Jennifer, I was just really surprised by how large and it is, and like it kind of spans over a large area as well. I think like being from Seattle, we're a little bit more tight for space. So even though I came from a large hospital system, I was really surprised by that. And I think one thing too that I kind of forgot to mention earlier that really drew me to moving here is just like the local population. So, I'm Vietnamese American. So there's a large population of Vietnamese people in San Jose area. And one of the things I noticed when I stepped into the hospital is actually a lot of the signs are translated in Vietnamese. And I think that's one of the things, like clearly we have a very diverse population here. We cater to a lot of different people, a lot of immigrant populations as well. And I think that's one of the great things about working here is that we get to utilize things like the translators and interpreters to help us make sure that even patients who English is not their first language, we get to be able to provide that care for them.
I think it's so wonderful that the community really does get this support from the county hospital system. Before we get into more of the patients and the care that they get, both in a care sense and as well as in a cultural sense, can we talk about the support that you get from people that you work with, mentors, things of that nature? Coming here, you're learning so much. Can you talk a little bit about the support system that allows you to learn in such a great way?
Yeah, I think in terms of mentorship, there's a lot of different ways. Like there's of course more formal mentorships. Like as a part of our residency program, we do get assigned a formal mentor, like someone we can really always reach out to on a quarterly basis to talk about, any of our issues in terms of residency or things we just want to talk about in general. In our personal residency, pretty much anything goes, right? Like that's the whole point of having a mentor. But I think one of the other things about our residency program is that there's a lot of us as residents. So there's 12 of us who are PGY1s, and then there's 4 PGY2s. Yeah, so there's a lot of us. So there's about 18 of us total. And so there's a big support system in having other residents that you can talk to about what your experiences are like. Talk to the PGY2s who have likely gone through this PGY1 experience before. I think in terms of having a large residency class, that's a really great support system for us.
I think not only, of course, I love having a big residency class. It's like a big family, you have everyone to relate to. And I really, as a PGY2, I love giving advice to all the PGY1s because, I went through the exact same thing that they went through. I think that, our preceptors are also amazing, as well as for me personally, the administration. They have been, for me, because I'm the administration resident, they have been such, big mentor for both my personal life and each one of us also have a residency program director for the PGY2s. Mm-hmm. So I think, the mentorship here and the preceptorships and the support that they can give has been really wonderful.
I actually think one good point too is I feel like a lot of the preceptors were previous residents as well. So I think that's another aspect of people who are teaching you who really understand what you're going through, right? Because our retention rate is pretty high for our residency program for people who stay on in the system.
I hear that all the time with so many of the different programs here is that many people who went through the programs now work on staff here full time. And I think that's a testament to really the wonderful experience that y'all must be having. Now going into the technological side of things as well, are there any things that set, I guess, this residency program apart from others, or really just showing that you really do have access to cutting edge equipment?
Yeah, I think at baseline, and then one of the things I was looking for in a residency program too was a program that was on Epic and a program that was using Pyxis. Just being on the same electronic health record and medication inventory system that I was familiar with previously was a big draw for sure. And I think also just in my opinion, I think that's one of the better electronic health records and it's pretty easy to navigate. So I think it's helpful for any incoming residents or just anyone on the healthcare team. It's really interconnected with all our clinics. We have all the information available from medication visits at PCP visits. I think that's really helpful for us in pharmacy.
Yeah, and I think at pharmacy at an administration level, we love technology. We're also always looking for the next big thing. And recently we went to a pharmacy conference, ASHP. So, we were looking at exhibits there, looking at what are the new cutting edge technology. Like, for example, at our inpatient, we have a machine called the box picker. The box picker machine, which picks medications. And once the order comes in. So we have that outpatient. We have these machines that can fill outpatients' medications. We have a whole central fill pharmacy, which fills medications for hundreds and hundreds and even thousands of patients every single day. So I think that we really love technology. We're always looking for what's the next big thing that can really push us, make us a cut above everyone else in terms of technology.
That's great. The machine that you mentioned, is that the huge machine in the basement?
Oh, yeah. You go down to the basement.
This is awesome. Can you tell us what this is?
Yeah. So we have 3 of them and they all have little names, I think, based on that.
Alvin and the Chipmunks.
Alvin and the Chipmunks. So, each store is different medications. One of them is the refrigerator box picker machine. So that stores refrigerated medications. Some of them store syringes and things like that. And then the other one stores just oral medications. So depending on if an order comes in, our technicians will go pick out the machine, pick the order, and then it spits out the medication. They grab it, and the pharmacist checks it. And we also have the tube station, so we tube it through.
Yeah, I think it's a pretty cool machinery because I feel like I also used to work at a hospital where we actually had to hand pick all the medications on shelves, right? So just like coming here and then having this like machine that kind of does all that work for you, it was pretty cool. I remember taking a video of it the first time I stepped in the pharmacy because I thought it was so unique.
Yeah, being a video guy here, I was enamored by it. And I'm like standing there just getting tons of footage of this huge machine just on tracks and picking things, and that's awesome. You mentioned some conferences. You get the opportunity to go collaborate with pharmacists from all over. Can you talk a little bit about these extracurricular opportunities, if you will?
Yeah, we like to go to a lot of conferences. So we have CSHP, which is the California Health System Pharmacy Association. Did I get that correct?
I believe you did.
So we have CSHP, which is on a California level. So we like to go to that. And also these conferences are a great way to meet other pharmacy residents, get to talk to incoming students about our residency program. And we also have ASHP, which is kind of, I think it's like the American, it's like the national level. So we also go to that. And, near the end of the year, we also go to what's known as Western States Conference. So all of us have to do research projects. So that's where we go present our posters, go to San Diego. And also, I think another great aspects about these conferences is bonding time too. So you get to bond with your co-residents and hang out with each other too. So it's very fun.
That's awesome.
Yeah, I think it's a pretty cool opportunity because our program does help sponsor us to attend these conferences too. And these conferences are a really great opportunity to network, as she mentioned, and also bond with their co-residents. But I really want to highlight that aspect of seeing what other programs are doing too, because it's a great opportunity to see other residents. They're already presenting their posters and stuff. And I remember for myself, I was thinking about my own research project and I went to the conference and I saw these other people doing similar research projects. So I was like, cool, what's going on over there at your hospital? How can I learn from this too? So I think the conference is a really great opportunity. And there's lots of CEs too, so you can really just stay on the cutting edge of new medications and technologies and things like Jennifer mentioned before.
That's fantastic. And it does sound like, again, you're caring for the patients and the community here, but then you're also going and helping each other take care of communities and patients elsewhere as well. So that is a really neat aspect, and I totally understand the impact that you all are having on the pharmacy practice. So going along those lines and talking about the technology that you have access to, the mentorships side of things that you have access to, these extracurricular opportunities to collaborate, it all culminates with patient care. And so, like you've mentioned already, Santa Clara County being a very diverse place, you're getting to care for people from all over the world. Can you tell us what that experience has been like when you're actually here? You're using your education and all of that collaborative experience to care for the patient.
Yeah, it's very, very, very rewarding. You really feel like you're making a difference in patients' lives. And I think when you talk to the patients, you realize, wow, there's a need. There's a need out there. And I am so glad to be part of a community of people who are also passionate about helping the underserved. So that was the biggest reason why I came here. I just love county health systems, being able to see the patients. And once you talk with them, interact with them, we help them with their medications, explaining to them what the medications is. Because a lot of times patients are they've just been discharged and say, oh, can you tell me what this medication is for? And a lot of times patient will forget, the discharge process is it's just scrambling, trying to move themselves out of the hospital, and they might forget. And you realize, oh, you explain to them and they go, oh, thank you so much. And you're made such a big impact on someone's life.
Do you have a similar experience?
I would say so. I'm actually on my TOC rotation, which is transitions of care. So I would say I'm really getting to have that experience of working with patients. And seeing how grateful they are when we take time to like walk through all of their medication lists, especially, you know, we do make special medication calendars for our especially high risk patients who are on a lot of medications or have new diagnosis of like heart failure or diabetes. And I feel like it's a really rewarding experience just to be able to walk them through and make sure they understand what medications they're taking, you know, how to use them appropriately, and kind of just answer any questions that they have. Because oftentimes, right, like if you're discharged on 10 new medications, it can be overwhelming and scary, but it's a great opportunity for us to use our knowledge to help our patients.
Absolutely. Utilizing knowledge to do your job effectively. But has there been a moment where you were interacting with a patient or you had some sort of opportunity to just sit back and go, wow, I know I'm exactly where I need to be and doing what I wanted to do?
All the time.
And
I don't know if you have any particular instances of that where you were able to really see the impact in front of you.
I would say definitely transitions of care when I was on my transitions of care rotation as a PGY1, especially when you do bedside. So sometimes when patients are being discharged from the hospital, they can't come to our discharge lounge. So, you know, we will actually go to their bedside to counsel them about their medications. And I've had instances where patients are actually blind. They can't see their medications. So learning to navigate and, you know, teach them, like, you know, I had a patient who was blind. They had trouble seeing and they had insulin injections. So learning how to navigate that, how to counsel the patient on how to inject themselves with insulin, that was a whole nother thing. So I think after that experience, I was like, wow, I really made an impact on someone's life. And I'm touching patients' population that I didn't even consider in the past that I would have ever seen. Yeah.
That is so impactful. Is there anything you would like to add to that for your own?
I don't know if I can. I don't think I have one specific instance, but I think we kind of touched on, you know, like every time a patient is just really grateful for us being able to go over their medications. I think both when they come into the hospital and when they leave, I think patients are just really grateful that someone's there listening, you know, hearing their concerns in terms of their medications, and then just making sure that, you know, all their questions are answered.
Talking about that culture of care too, within the pharmacy residency program where you get to have access to the tech, the collaborative learning, having these impactful stories, what is the culture like in terms of the broader multidisciplinary aspect of care as well, where you're interacting with people who are outside of pharmacy as well? What's that experience been like?
Yeah, I think it's been super great. I actually came off my internal medicine rotation recently. So as a part of that rotation, we do multidisciplinary rounds. So I go to round with one of the hospitalist teams. I actually get to work closely with some of the residents and the attending. And then here and there, when we work on different consults, we can work with like the dietitians and of course the nurses. So I think it's been a really great experience to hear from different perspectives. You know, I think it's great on rounds that we get to all kind of have more of a collaborative discussion versus just, you know, sending a message here and there, like, here's what I think, versus like, we're all in this room together discussing our ideas about medication therapies or what's going on with the patient, and having us all be in the room together, I think is a really great collaborative experience.
I think that being part of the team, and I think what really sets here apart is the collaborative aspect. I think when you go on rotations as a resident, you realize, oh, everyone loves pharmacy. You know, you show up in the team and they say, oh, hey, pharmacy is here. Woohoo. And they have a lot of questions, a lot of, you know, medical residents, and that you'd be glad to answer. And I feel like every time we share our own knowledge, I feel like we're also making an impact, you know, on the pharmacy profession too. Like, you know, we talked about earlier that traditionally it's been more of a dispensing role, but getting to utilize our clinical knowledge, like, you feel like, wow, I'm advancing the whole pharmacy profession forward too.
You absolutely are. That's for sure. I love that. You said when the pharmacy team shows up, people are pumped. They're excited.
Yeah, that's the best part, honestly. I've had someone be like, yeah, oh, wow, pharmacy's here today. Like, I've never had one on the team before. This is like the best.
That's awesome. So there's fun too to be had, I'm sure. Can we speak a little bit about that, whether that's inside the hospital or outside the hospital as well, with your large intern class?
I say inside the hospital, we have our own residence room. So it's really nice. We all hang out in there. We talk about, you know, everything. So that's also awesome. We also have food in there. So that's a great place for us to chit chat, debrief. You know, they told us this is your safe space. So you can let everything go in here. So yeah, I think I really enjoy our residence office.
Yeah, I think inside the hospital is pretty great. Like, I'm pretty close with one of my co-residents, and we try to meet up for lunch every day. So, you know, that part's good. I think in terms of outside, I actually happen to be one of the social coordinators for our residency class. So we at least try to plan like one big formal social, like actually planned, which is nice to get us all together because, you know, life gets busy with deadlines, projects and things. But it's nice that we at least get together every once a month. But we also try to do like more informal stuff. Like I remember, especially when we were getting to know each other at the beginning, we had lots of like twice a week events. Like we would just go to like Korean barbecue or do trivia or just, it's really nice because we have a lot of group chats and everyone will be like, hey, like I'm going to see this movie. Does anyone want to come? Or like, hey, I'm checking out this new restaurant. So it's really great to have like basically like 14 friends on speed dial, right? Yep. So that you can call up anytime and hopefully at least one of them shows up.
Let's talk a little bit about where we are located and kind of the access of those recreational activities that you have access to. We're right in the heart of Silicon Valley with mountains, with city life, everything. Do you all live close to each other, to the hospital? What's your life like outside of work?
I live pretty close to the hospital, actually, like 5 minutes. I've contemplated walking sometimes. I haven't quite got there yet. But I feel like it's pretty nice being here, like in close proximity to like SF if you want to go, or, you know, and there's lots of great food, I've realized, in a lot of different areas. I feel like San Jose is really quite large. And just like even all the way up to SF, there's tons of places that I've been checking out since I've moved here.
Yeah, I actually live at home, which is about 20 minutes away from here, but I think what people will realize when they come here is how big San Jose is. It's big. And we're very close to everything. Like, you know, below us, we have Santa Cruz, we have the mountains, there's a lot of hiking places. Mm-hmm. You know, Tahoe isn't that far away, so.
Sounds like there's a story coming our way.
Oh, we're only laughing because I went to Tahoe this last weekend and I got snowed in. So
yeah, you're here in a studio.
But I made it here. So
what happened?
Well, I tried to go up there snowboarding and then the highways got closed from a winter storm. And I mean, I've never been up there, so I didn't realize this was a common occurrence. And I was stuck up there for a few days.
All right.
No power, no Wi-Fi.
Snowed in on the weekend, doing a healthcare podcast. By the weekdays. Yeah. I love that. Well, we're glad that you're here. So
thank you.
That's so cool. I know you mentioned it was, it's like a family, and I love that. You mentioned there are 14 residents or so?
I guess there's 18 of us.
18.
Yeah, we got the 4 PGY2s. Yeah, it's 18 residents.
Can you name them all really quickly? No, I'm just kidding. Won't put you on the spot.
We could do it.
Probably could. Yeah.
Slowly go.
Well, that is so fun. If you were to imagine someone listening to this right now who is considering becoming a pharmacist one day, or even at the stage of considering where to further their pharmacy career, what is one thing that you would tell them about considering coming to Silicon Valley and more specifically to Santa Clara Valley Healthcare?
My favorite thing about this place is the patient population we have and making a direct impact in our patients' lives. So I think for me, that's the highlight of why, you know, if anyone's interested, they should really come to here at County Santa Clara Health System. Yeah.
Yeah, I think for me, I would say something similar. I think also it's just like the unique, like the breadth of experiences that you get to have here because you get to work with a bunch of different patient populations. It's a teaching hospital, so you get to, you know, learn a lot from the other in an interdisciplinary way. I think that's the greatest part about being here. We have a lot of collaborative practice agreements too, so I feel like work is progressive here for pharmacists. I
love hearing that. I hear all the time the things that you all are saying, and I think the case of diverse patient population, just the wonderful learning opportunities that are here, I think that really speaks to the fact of all of those things, and really that is a testament to just this being a wonderful place to work, learn, receive care at Santa Clara Valley Healthcare. We thank you so much, Victoria and Jennifer, for coming on The Beat today to share all of your insight into the Pharmacy Residency Program. And I can't wait to share this episode with everybody. And check the weather forecast before you go.
Yes. Lesson learned.